Good morning and good afternoon to our viewers in the United States, and good evening to our viewers in Europe. I'm Amanda D'Aquila, Executive Director of Heidelberg University Association. I'm pleased to welcome you to the third virtual Heidelberg Lecture. The Heidelberg Lectures are a collaboration between the American Council on Germany and the Heidelberg University Association. Today's discussion will focus on the economic impact that the COVID-19 pandemic has had on women in the United States and Germany. Populations of both countries have experienced dramatic shifts in the labor market and economic stability through different iterations of lockdown, school closures, and shuttering of many businesses. Our experts will examine the immediate economic impact of this disruption on women in particular, the structural issues that it has exposed, and what the long-term impact could be.
I'm Steve Sokol, the president of the American Council on Germany, and we're pleased to once again be partnering with the Heidelberg University Association. Having had the pleasure of studying at the Ruprecht-Karls-Universität as a Kurzzeitstudent, it is my great pleasure to welcome Professor Dr. Christiane Schwieren. She is a full professor of organizational behavior at Heidelberg University, where she also holds the position of Gleichstellungsbeauftragte, or Equal Opportunities Commissioner. Before coming to Heidelberg in 2009, Christiane Schwieren was an assistant professor of economics in Barcelona, and before that, a postdoctoral fellow at the University of Mannheim. She studied psychology, political science, and history at the University of Heidelberg and completed her PhD in economics at Maastricht University. Herzlich willkommen, Christiane. To offer a US perspective, I'm pleased to welcome Julie Kashen. She is a senior fellow and the director of the Women's Economic Justice Program at the Century Foundation. Julie has more than 10 decades of experience focusing on work and family, caregiving, economic mobility, and labor. She has worked in the nonprofit sector and in government at both the state and federal levels, and has helped draft 3 major pieces of national legislation. Thank you for joining us today, Julie.
Thank you. And I'll just say it's more than 2 decades, not 10 decades.
Sorry.
I look good for my age. But.
I apologize. And to guide us through today's discussion, I'm delighted to introduce Birte Meier. She's an award-winning investigative journalist and a senior producer with the national public television broadcaster ZDF. In addition to numerous awards, she's been recognized with a number of fellowships, including the Anna Maria and Stephen Kellen Fellowship from the ACG a decade ago. Most recently, though, she was a Thomas Mann Fellow in Los Angeles, where she conducted research on equal pay. One last thing before I hand the floor over to Birte and the panel. If you'd like to ask a question, please use the Q&A function in Zoom, and we will try to fold in as many of your questions as possible. And with that, Birte, it's over to you.
Thank you, Steve, and good morning to our viewers in the US and good afternoon to our German viewers. I am Birte Meier, and I'm very, very honored to have been asked to moderate this panel. I'll be very brief now. 9 months into the pandemic, it's very clear that COVID has had disastrous effects on women in the workplace, probably all over the world. That certainly holds true for women in Germany and in the US. The topic has been around for a while. However, today we would like to have a transatlantic perspective on the issue. And I'm very excited to have 2 experts on the subject. And I'd like to start with Professor Christiane Schwieren of University of Heidelberg. What has been the impact of COVID on women in Germany?
Well, first of all, thank you for having me here and organizing this wonderful event. I'm very excited to discuss with Julie and you about this topic. So if talking about the impact of COVID on women in Germany, there are several factors, and I think they are probably more or less the same structurally in Germany and in the US. So one aspect is the work-family situation that you have with the lockdowns and homeschooling and school closures and all these things. And in Germany, that has stimulated a kind of retraditionalization debate. So the question, are we going back to our old traditional gender balance or gender roles? And that's basically also where my research is focused on when I work on that topic myself. So that's what I have most to say about. There are other aspects, though, that I think are important. One is the general labor market situation for women and actually also for other minorities, and the type of jobs women are in and the dangers involved with these jobs. Of course, they all somehow relate, so they cannot be seen as completely separate. But so if we start with a general labor market situation, what we see this time, in Germany at least, is that women are more affected than in other crises. So of course, an economic crisis affects everybody, but this specific crisis is, as compared to the financial crisis, affects women more than the financial crisis did for several reasons. One reason is that this time the typical female jobs are more affected. And that's actually, by the way, the other point, that women work over proportionally in tourism, in gastronomy, in factors that are now affected and that have not been so much affected by other economic crises. On the other hand, however, women are also more often in the so-called system relevant jobs. At least in Germany in the beginning, there was a definition what is a system relevant job, and that was basically healthcare, all kinds of healthcare and supermarkets, basically. So these were the two places that were, two things that were still open throughout all lockdowns. And where you, for example, and now we are back to the work-family issue, where you were allowed to give your children into care, even though everything else was closed. For everybody else, it was closed. So that has two aspects for women. One is that the danger of catching COVID was higher for them in these jobs, and still is. And right now, this is a big debate about the educators, about the women in childcare that are asked to, with the small children, that are asked to work without masks because that affects small children. The same in the elderly homes, or those who work with handicapped people. They are usually often have to approach people very closely. Sometimes have to work without masks because otherwise the social interaction doesn't work. So they still have jobs, that's good. And they get also a bit more, at least public recognition, but they are also more exposed and they cannot do home office. In these jobs, you cannot do home office. And there we are back to the first problem. The whole thing actually holds also for people with migration background. Basically, they're very much the same argument. But moving from that now first to the work-family situation, because that's what I've been working on most. What we've seen in Germany, and that is in Europe relatively special. So the full-time labor market participation of women has really increased in the 2000s. So it's relatively recent. And that was also a time where there was a huge increase in quality childcare. So the increase in quality childcare meant that more women could work full-time, more women could enter the labor market. And that's exactly what was closed now. Meaning that these women were severely affected because suddenly all these structures were gone. Also, people did not recommend and also did not send their kids to grandparents anymore, which was not a big thing in Germany anyway, but which was an issue of childcare. So meaning that now these families were confronted usually with a combination of the job with homeschooling, childcare during the school lockdowns. And we are in one right now again. So this led to two things, basically. What we've seen in own studies and what we've seen in a lot of now representative studies is that this led to an incredible overload, overburden for women especially. Some women solved this by dropping out again of the labor force, or at least reducing hours. And that is, in most of these cases, this is irrational, because especially in the lower income groups, very often the men earn more. And then it makes sense if someone has to reduce, that it's the one who earns less, especially if you really are struggling to make ends meet anyway. So in that sense, we see kind of a retraditionalization. So in certain segments of society, women drop out or reduce hours more than men do. However, what we also observe is that, especially in the higher educated segment, men are more involved in childcare than before. And what we see in the statistics, they nearly doubled their implications in childcare and housework. However, this nearly doubled sounds fantastic, but the nearly double is from a tiny bit to a less tiny bit of housework and childcare. So, so my conclusion from all the data we have seen so far is that we are not really in a retraditionalization. We are more in, we still had a very traditional structure. So if I look at the data, we have like 50% of German families before the Corona crisis were women, the only one who took care of the children. And so this is still the case. Men take up a little bit of it. So we still have this situation where women are overburdened with homework, children, and now partially also home office. But this is not because we go back to an old traditional model, but because we were still living mainly a pretty traditional model. So even in families where women and men worked full time, women had the higher share of childcare and household duties. So what I would conclude on that is that, well, we have a higher burden on women nowadays. Very much so. You asked also outlook for the future. I won't be so sure that this is only negative. I think for some women, of course, they interrupted their career again, they reduced hours, they may not come back. But in the higher, especially in the higher educated segment, men took over more. Men saw how much of a job that is. And there might be, at least in some groups, a slight change of men getting more involved even after the crisis. So that's one thing. So how long should I go on? I have lots of things I can tell, but
maybe. Thank you. Maybe we change for the US perspective and then come back to the German
exactly. Wonderful.
Thank you very much. So at least for Germany, there's some hope at the end of the tunnel, because basically what you're saying, if I put it in broad terms, is that we've been so traditional for so long by international comparison that sort of the few men who are participating more in the caretaking responsibilities at home is an advantage in all the sort of other disastrous effects, if I understand you correctly. You just mentioned that women in Germany participated more in the workforce only in the 2000s, which is quite late. I think in the United States, it was a lot earlier. And before COVID, women had reached, sort of made up half of the workforce. Now that they're sort of dropping out in quite large numbers. So Julie, what are the impacts of COVID in the US? Maybe you could give us a brief introduction.
Yeah, absolutely. Thank you. Thanks for having me here. And unfortunately, I feel like so much of what I just heard, like I kind of want to just say ditto and like be done with it. I was sort of hopeful that we had a better story coming out of Germany, but I will share the US perspective as well. And also I have a small class of first graders in my living room right now, so hopefully there won't be too much noise, but just speaking of the situation that we're all experiencing. So yes, as you said, there in February of 2020, women in the US actually had reached basically an equal number with men in the workforce. And then COVID hit. And basically since February, what we know and what we learned last month is that more than 2 million fewer women were in the workforce in December than they were in the February before the pandemic. So that's about 2.1 million women, right? So that's huge. And in fact, last month, the people who lost jobs in the US economy were 100% women. The majority of them were Black and Latinx women. And so, you know, we've talked about this as it's not a recession, it's a she-cession. And we are fully in that in the United States. A New York Times reporter, Patricia Cohen, said, you know, women have had essentially a 1-2-3 punch here. And I've amended that to say it's a 1-2-3 punch and a kick, which again, very much reflects what happened in Germany, because the first punch was that women lost service sector jobs, that in retail and restaurants where occupational segregation has meant that women make up the majority of those jobs, you know, that those jobs went away because we had to close down so much of our businesses to protect ourselves against this pandemic. Then number two, punch two, was the public sector, where state and local government, where women also make up a lot of those jobs. And as budgets began to shrink, those jobs went away too. The third was the closing or the reduction in childcare in schools, where women ended up having to take up more of that. And then the kick was, as you mentioned, the frontline workers, especially Black and Latino women who were on the front lines, you know, as nurses, as healthcare, as, you know, the drugstores and the pharmacies, who had to go to work and risk their own health and their family members' health because of this. And so it's really been painful for women, and especially for mothers. And I wrote a report with Sarah Jane Glynn from the Center for American Progress and Amanda Novello, a colleague at the Century Foundation, where we found that, you know, if the April trends held true for maternal labor force participation and work hours, that the economy would lose about $64 billion over the course of a year in lost women's wages, because they had to either drop out of the workforce or cut down their hours to take up the caregiving responsibilities. And, you know, what we've seen is that even as more men are home and more dads are home, and some are certainly taking up more of the responsibility, that the responsibilities are more as traditionally falling on women. And I know, you know, even in my house where I have a very equal marriage and we both do a lot, it took about 2 weeks for my husband to ask for the remote learning password for my son, just because he hadn't thought to do it, right? And so, you know, I just automatically started doing that piece of the work. Once he did, then he started taking it over, and it was much more even, you know, but we would have to every Sunday night look at our work schedules and say, okay, I got this block of, you know, childcare, you've got this block of childcare. And we are very lucky to be in a more privileged situation than a lot of folks, where we were able to be home, where we still have our jobs and we only have one child, and still, you know, really having to balance it is struggling. And so what we know is that, you know, there's the immediate impact of, you know, job loss or managing jobs with additional caregiving responsibilities. And then there's the longer term impact on women specifically, and on the economy. So in terms of, you know, the longer term, once you leave the workforce, it's harder to get a new job. And especially if jobs are not available right now, it is much harder. And that can have long-term effects. We know that, you know, we already had significant unequal pay in this country, where Latina women were making 55 cents on the dollar for every white man, Black women 63 cents on the dollar for every white man, right? So we're already in this situation where wages are not equal, income is not equal. And, you know, that is going to be exacerbated by all of this. And then retirement security, that we are losing out on retirement security. When you stop working, no one's paying in for your retirement. Caregiving isn't counted toward your retirement. And so, you know, this is really going to have major implications for women, for gender equity, and then for the economy and the economic recovery. So, you know, losing $64 billion of wages in the economy is a huge deal. It's gonna, you know, that has another impact on tax revenue. And, you know, women so often are the breadwinner or the co-breadwinner in their family. They're the people bringing home money to pay the bills, you know, to care for their kids in in that way. And so, I think there's a lot of concerns. I guess I just add, there's a few different pieces. It's not an accident that we're in this situation. These are intentional policy choices that prioritize male ways of doing work, that deprioritized and devalued care work, which was primarily done by women and immigrant women and women of color. And the good news about the fact that we're in this situation because of these policy choices is that we can make new policy choices. And I think with new leadership in the United States and a new understanding of the situation because of what we've all just been through, we really have an opportunity for that. So I will stop there to have more in-depth conversation.
Thank you. I'd like to delve into the sort of the future a little bit later. I have a question from the audience, from a viewer. May I read this to you? Okay, as we start to come out of the public health and economic crisis, how long do you think it would take to recover from the she-cession, sorry, 1 or 2 years or as many as 5? Do you have any opinion on that?
It depends on what we do. If we're able to pass a big stimulus bill in the United States, that includes the at least $50 billion we need for childcare, that includes the paid leave that parents and family members need to be able to care for their loved ones and themselves. If we put money into the care economy and we say that these should be good public jobs that are paid good wages and should be available to everyone, we can really get out of this quickly. There are absolutely ways to do it. If we don't make those policy choices, however, it's going to take a lot longer.
Thank you. So what we're seeing on both sides of the Atlantic is that the pandemic is shining a light on structural disadvantages on women in the workplace that they've been suffering for decades at the very least. They're overproportionately represented in caretaking professions and working as nurses and teachers, etc. And also at their homes, they're basically now juggling homeschooling and home office. So and of course those jobs, as you've both pointed out, they're underpaid and underappreciated. So it looks like there's a lot. Germany and the United States have a lot in common. And there aren't that many differences. However, Germany praises itself for having a fantastic welfare state, and it has spent tremendous amounts of money to support those in need due to the pandemic. Kurzarbeit is one of the policy tools to keep employers from laying people off who otherwise might lose their jobs. So my question to Christiane would be, if you look at it at a transatlantic perspective, has Germany done enough to support women in COVID crisis, or would it be helpful to sort of have a feminist perspective on support politics during the pandemic?
Has Germany done enough? Well, I mean, of course, structurally, we have a lot of things that help, obviously. And even if you look at the more precarious jobs or at Kurzarbeit and these things, so far, at least there is no obvious gender bias. So, but of course, also the data is not conclusive yet. I mean, we're not done with that. And the government has put a lot of money in keeping things alive somehow, which sometimes work, sometimes are not enough, but we will only know at the end. So as, for example, now there are different rules for, I'm lacking the English word, for the Insolvenzverfahren. So,
that's a hard one.
so let's say, so firms are kept artificially alive, maybe. So I'm not a macroeconomist, but it's a big debate right now whether we have zombie firms that will just stop existing after the crisis. So I think it's too early to say how these structures really work to support everything and where it will end. However, on the feminist perspective, of course, I mean, there are many other European countries who decided differently with respect to school closures and childcare closures. And I think that's a huge thing. I mean, in March, we've seen that it doesn't work. to have people in home office and homeschooling and childcare at the same time on one hand, and on the other hand have the women in the system relevant jobs not seeing their families anymore because they could bring the disease into the family. And then there was the summer, and everybody in politics, basically, people behaved as if, well, after the summer, COVID will just be gone by miracle, and no concepts for how to reopen schools, no concept for, is there a safe way of doing that? Just basically hoping it will be gone. And then now we restarted in the same way. And there's another issue, I think, where Germany really cannot be proud of. I think we are on the index of digitalization. We are the lowest in Europe. So there were schools where people still cannot at all handle any digital teaching. So I see that to come up with personal experiences. I have 3 kids, 2 are in a very digitalized school and sit in front of their computer the whole day, and the 3rd one gets every Sunday a nice pile of paper, which is fine. They're at least trying to take care of it. But there, if you look around in Europe, there are countries where this is better solved. And in that sense, I think neither children nor women nor families who are struggling, low socioeconomic status, refugees, had any lobby. So they were not the priority to focus on how can we solve these issues. And I think that will be a big thing in the future. That in Germany, we have a huge education gap. So if your family is like the family my kids are born in, with 2 academically educated parents, they will have more or less a good life. If you are of lower socioeconomic status, you having a very hard time even to get to university. So, and this will grow, because now in my family, of course, we have for 5 people, 5 computers. So no problem here whatsoever. And if the kid doesn't follow this online teaching, well, then I'll sit down with him afterwards in the afternoon and can explain everything until highest school level. If you don't have that, if you're low socioeconomic status, if your parents don't speak German well, then the kid is just is not able to follow. Maybe they even don't have a computer, but very probably parents cannot help. And so here the gap will widen tremendously in Germany, and that I see as a real danger for the future. So, and politics completely ignored that.
Yeah, thank you. So in Germany, the pandemic is going to worsen social inequalities because homeschooling doesn't work for people who are from disadvantaged backgrounds. I completely agree. And I think that's sort of common sense. If we look at social and racial inequities in the United States, really, I suppose that the social inequities are going to be on the rise as well. However, I suppose that maybe the racial inequities the situation is a little bit different. I don't know. I'd be interested to know. Could you tell us?
Yeah, I mean, I think we're in a very similar situation also, where the pandemic has completely increased our inequality across the board, whether it's economic, whether it's educational, whether it's gender, whether it's racial, right? Every single area we have seen increased inequality, and it's because we started out with a system that wasn't focused on creating equality, that was focused on, very much, every, rugged individualism and, every person for themselves. And so we have the situation where the pandemic showed us we are so connected to each other, right? That like my getting sick impacts you very directly. Right. And so as we see kind of what the spread of a virus means for communities and families, that, we are all in this together. We are one giant community, and what happens to me matters to you, right? What happens to her matters to him. And so, I think we have this huge opportunity now to say our systems weren't working. They didn't work before. And what we need to do is not build back what we had. We actually need to reimagine and create new structures and new systems that are going to support, this interconnected idea, right? Because we're so in this kind of, I always call it the DIY, like the do it yourself, right? Every family for themselves, that it's, you're on your own to address all these problems. And, I think if we can build systems where I'm part of it, I'm part of the solution, and the government's part of the solution, and the employers are part of the solution, that's how we're going to be able to build a system that's really going to work. Your question was specifically about racial equity, and we've had, a very interesting time in the United States during the pandemic around racial equity issues. And I think, I don't know whether it's because so many people were at home or already on this heightened kind of awareness and heightened piece, but when George Floyd was murdered by police in Minnesota over the summer, people really were impacted by that and understood, like, oh, this is part of a system. This is part of racism. This is part of structural racism. And we're not going to let that be okay anymore. And we're going to figure out, what do we need to do? Many white families said, what do we need to do to address racism? What do we need to do to address the biases that we have that we didn't realize we had? And I think this is, so incredibly important that we do for racial equity. And it's important that we do for gender equity, that we start to say, oh, we have been, operating in these structures, in these cultural norms that say being white and male is better than being female or not white. And we need to start to figure out how to change that overall.
Yeah, and then Christiane just said that women don't have a lobby. So I mean, we're basically talking about facts that we've been talking about for a very, very long time, only now that the situation has worsened a lot. Do you think this is going to change at this particular moment in time because the situation is so bad, or is it going to fade away because there's so many more problems to talk about? What's your opinion?
Sorry, that's for me?
Yeah, please, sorry.
Okay, great. We cannot let it fade away. We can't. Of course, part of the challenge is the people who are the busiest, who are trying to work their jobs, care for their kids, care for their aging parents, are the people who need to be out there saying, this is not okay. We need change. We need a smart childcare system. We need paid leave for all. We need workplace policies that accept that we are caregivers and people who work, and that, that's true for women, that's true for men, and we need to make sure that it's true across the board, right? We have to stand up. We have to, speak out and use our voices collectively. And it's just, we cannot let it go backwards.
Okay, thank you. Here's another question from the audience I quite like, and I put it to you, Christiane, if I may. One of our viewers agrees that policymakers have set the course for allowing women to re-enter the workforce. But the viewer points out that we might have to rethink the ways we work when it comes to a more flexible work environment and fulfilling part-time jobs. Are there any exciting initiatives in this area? And I might add, my question, is that going to level out inequities if you're putting the focus on more flexibility in part-time work?
Well, I think that there are now discussions about whether we need 40-hour work weeks in all kinds of jobs. There are discussions of more flexibility and now that we see that, at least in principle, in many more jobs than thought about before, home office is an option. And without childcare at the same time, home office is not bad. I mean, so there are discussions. Will this level out inequities? It has the potential, I think. Where I'm a bit worried is the human being in a way, because we're so much craving now for going back to normal. That right, what you just said, Julie, those who have been overburdened now are the same who should now go out and say, okay, let's change the way we work and let's change all that. But I'm a bit afraid that when this is over one day, everybody is so happy, like, okay, now it's gone, that we will just be happy with being back to normal and forget about all that again. So it might get lost on the way.
It might very well get lost. If I might add another question, I mean, we're now decades after the 70s in the feminist movement, and we're now 2021. Did this development surprise you? Would you have foreseen it, that the situation that women in the workplace are still so vulnerable?
Yes and no, right? We've certainly made progress, right? As we said at the beginning, the number of women and men in the workplace was equal as of February 2020, right? That was different than it had been before. But we also know we have not built up the systems and structures that we need to make that sustainable. So instead, we've built it on the backs of women's stress, of women's, lack of sleep, of women, making lower wages, or, of immigrant and Black and Latino women who are, doing the caregiving for, way too little wages and poor working conditions, and essentially being the invisible work that makes all other work possible. So, we both made progress, and we have a long way to go. And we also, if you look around at leadership, right? Leadership matters, power matters, who gets to influence what laws get made matters. So, I think about it. So in the United States, for example, we have family medical leave, which was enacted almost 30 years ago. And that says that if you need leave to care for a newborn baby, a newly adopted baby, a seriously ill family member, you can take 12 weeks of leave. And it's unpaid, but you can have your job back at the end of it. And it's only for people in larger businesses. So we basically created a policy that says, okay, we think caregiving is important, but not important enough to pay you for that time, and not important enough to make sure everyone has it. And then, almost 30 years later, we're still fighting for it to be paid. So on one hand, we've made progress. There are states that have adopted paid leave policies, and there are cities that have adopted paid sick days policies, that say that caregiving is important and you shouldn't have to give up your paycheck in order to care. But at the same time, we're still fighting for paid family leave in the United States, and we still only have 12 weeks, and that's become normalized. I remember when I had my baby, after 12 weeks, he wasn't sleeping through the night. Like, how was I going to get back to work and really function as a person in the workplace, when I wasn't able to sleep? And we ask people to do this all the time. And so, I think we have to step back and say, like, what are our assumptions? What are the cultural norms? And how do we get women into positions of power so that they're the ones who are saying, like, oh, family leave is good, but it's not going to work if you can't have paid, right? And so I think, we still have a long way to go too.
Yeah, do you want to comment on that, Christiane? Because in Germany we have very, very generous paid leave. It's 12 months for one partner and then extra 2 months for the other partner. And so by American standards, that's sort of outrageously generous. However, we're still not, it didn't help a lot, or it didn't level out inequities, of course. How do you explain that, Christiane?
I think that the important point is we are always only trying to change everything for the women, but we should also consider the men. So, I mean, the German, you just said it, the men get 2 extra months, or you get 2 extra months if the men take it up as well. Other countries have been more generous in how many extra months you get if the men do it as well. And I think that would be the way to go, because you still end up having, if you hire a woman or a man of the same age and they have children, it's the woman who goes on the long leave and the man goes on 2 months. So as an employer, your risk of having someone on leave for a long time is still much higher if you have a woman than if you hire a man. And we also have to change the things for the men. They should go on leave. They should pose the same risk to their employer. They should take up leave. They should take up childcare. They should. So, I mean, it's frustrating, but to give an example, and at the university where I had my first position, there was long since the women lobbying for having all important stuff not after 4 o'clock in the afternoon, because then childcare ends, they have to go home. It didn't work. The moment the men said, okay, we want to take care of our kids, so please stop this, have no important meetings after 4, it worked. So we need both, and we need the men who want to take care of their children and who accept that this is an important thing and also fight for their right to have it, and not just making things work for women while the men are still working. I mean, if you look at it in academia, women publish less, men publish more during the pandemic. I mean, this can't be.
Yeah, completely agree. Thank you, Christiane. So one of the main hopes would be that men are being involved in debates around sort of gender equity. The other one, Julie, you just mentioned, which is leadership. I have another question from a viewer. Steve put forward to me, which said, where is it? One of our No, here it is. With the new administration in Washington and elections on the horizon in Germany, one of our viewers wants to know if you see the change in government leadership as opportunity or a challenge. And that, of course, we now have the first female vice president in the United States, so hopes are up. Do you think, how is that going to play out? Julie?
I think we have a lot of potential. I think that, you know, with Vice President Harris as, you know, the first woman of color as the vice president, I think, as I think about the people who've been named to high positions in the administration, everyone from the cabinet to the folks in the White House, there are a lot of moms there. There are a lot of women there. There are even, you know, there are a lot of engaged dads there too. And I know, you know, President Biden has been a caretaker in his life or a caregiver in his life and understands the importance and, you know, has tended to run, run his offices in a way that is thoughtful about the needs of people who are caring for their loved ones. And so I think there maybe, you know, we'll see some of that from the top down. At the same time, there's so much work to do to undo the pain of the last 4 years. You know, not just the pandemic, but our prior administration. You know, we had a leader who gave a speech about how everyone, you know, there are so many women in the audience because they want their husbands to get back to work, right? There's still this like old thinking that we're coming out of. And so there's a lot of work to do to even just get back to this kind of level of decency and care in our government, and then build. But I am certainly hopeful that we have the right people there to do the work.
Thank you. Christiane, what do you think? Are you optimistic about the elections in September and what it's going to mean for women in Germany, women in the workplace? Because we have had, obviously, a female chancellor for a very long time now.
I don't know. It depends on whether the groups that have formed now around women in the crisis manage to keep that on the agenda, or whether this is really going to be an issue in the elections, or whether in the end the general economic aspects will be more important.
Yeah, we've been talking about women as victims of the pandemic, basically. One might, and rightly so, because they're heavily represented if it comes to their place in the workplace. However, we might change the perspective, and I'd quite like to do that at the end, which is what does it mean for the economy and for businesses if women, and very many of them qualified as well, are dropping out of the workforce or are reducing their hours and are basically being pushed out of the game. Is there going to be a talent gap? Is there going to be a hindrance for economic recovery? Who would like to start? Julie, maybe?
I'm happy to. Yeah, I mean, right. That's the thing. Like, this is about gender equity and gender equality and racial equality, and fundamentally, it impacts our economic recovery. If, you know, women's gains in the workforce have been incredibly important for keeping families, you know, going and for keeping communities going. And so we're not going to be able to recover. Our economy is just not going to be able to recover if we don't do the things we need to do to set up women for success in the workforce, so that we have greater equality. And so, you know, this is not a women's issue, it's an everybody issue. And, you know, there's absolutely reason that we should have economists across the country screaming that we need a care infrastructure built in, and we need to build these systems that are going to immediately put people back to work. So I think there's a lot that we need to talk about why this is so central to our recovery.
Christiane, do you have an opinion on that? How is gender inequity sort of having its effect on businesses and the economy in Germany?
Well, I think there is not much to add to what Julie just said. I mean, we're lacking talent. We're increasing inequalities. Birth is not good. We're increasing educational inequalities, which is not good. And no, there's not much to it. I think it's basically the same issue. We have to see, we have aging populations. We will be lacking talent in Germany. So if you get a large group of people out, that's not good for recovery, of course not.
No, neither for recovery nor diversity, of course. There's a question regarding education. What are the long-term implications of the negative impact on education? Are we looking at a longer-term problem as mothers try to catch up their children to make up for the uneven education or even the lack of education children received this year? Are there initiatives underway in Germany to address this at an institutional level or in the US? Maybe we start with Christiane?
So it's about initiatives.
Yeah, basically the person wants to know, has anybody thought about the problem, how to solve the problem that a lot of children are being underschooled, and if they're not basically in academic households or come from households with higher education, then they'll be suffering long term. Are there any initiatives to alleviate that? I'm not aware of any, are you?
I think unfortunately not on an institutional level. I mean, there are a lot, like Julie said, everybody trying to solve it on their own level, like schools are trying to solve it on their own level, families, initiatives within cities, villages, but institutionalized, not yet. There were some macroeconomists here from Mannheim who made estimations how much this may impact on a whole generation's earnings. I have the numbers somewhere, but it was an impressive impact on a whole generation's earnings perspective. The lack of schooling of at least 1 year or less education of at least 1 year, and then for some, for more than usual dropout. But institutionally so far, there has been a surprising lack of ideas how we could catch up with that at some point.
Are there any initiatives?
Yeah, I mean, one of the things that I think has been so concerning about the schools is we've had, in for example, I live in New York, and in New York City, they have said, okay, restaurants can be open and we're going to figure out how to make that safe, and schools are closed. And so what are our priorities? What are we, so we have restaurants all over that have these beautiful like outdoor settings now where you can go and they have heat lamps, but they haven't done that for schools. And so, we definitely need to reprioritize and say, what are we doing and how do we make schools safer? And I think that thinking needs to start right now for next school year, right? September is going to be here before we know it. And so, I'm hopeful the new administration and the leaders there get that the lack of national leadership, the lack of, guidance from the top has been really problematic, especially when it comes to schools. And that now we have this opportunity to say, okay, here's what you need to put in place. Here are the resources to put those things in place, and let's move forward. But the reality is, like everything else we're talking about, we're starting on such an unequal field that, already we had so many educational inequities before the pandemic started. So it's really just exacerbated them. So we need to do better and get schools open for September, but we also need to be thoughtful about what else we can do to create a greater educational opportunity for those who haven't had it.
Okay, thank you. There's another question which keeps popping up in various variations, so I guess people are really interested in that. Given the aging populations in the US and European Union and the disproportionately large representation of women in the caregiving sector, would you expect increasing job opportunities in the elderly care space where technology cannot necessarily replace people? Who wants to start?
I'm happy to. This is a huge issue. I mean, we have not solved this at all. We have no plan in place. People basically, if you need elder care, you are paying for it out of your own pocket, or you have to get rid of all of your assets to get Medicaid to support you on that. We have a bias, an institutional bias, where we have more federal support or more government support for nursing homes and congregate care settings than home and community-based settings. And we pay about $11 an hour for the home care workers and the personal care attendants who are doing this work. We don't give them all of the same rights and protections as other workers have in this country. And so, we have on the one hand, our, aging parents, our aging baby boomers, where we're going to have so many more folks who are 65 and older than ever before. And we don't have anything in place that's, fundamentally going to address that. And often women are the ones who are caring for, their loved ones and also the ones in the workforce. So there are a number of things we can do for this. We can address the issue of immigration. A lot of the people in these jobs are immigrants. We should have a path to legalization for folks who are doing these kinds of jobs. We need to fill this labor supply. We absolutely need to make these better jobs. We have to pay them better. We need to put public funding into that so that we can make sure that these are good jobs that have health insurance, that have retirement security, that are safe, and people are cared for. We need to make sure that people can age in their homes and their communities when they want to. And so this is a huge issue that, during the campaign, the Biden campaign did talk about their plans for building this out. And so we have an opportunity now for Congress and the new administration to say, we're going to address this before it becomes a huge crisis.
Christiane, you were just, thank you, Julie. You were just starting to answer that question. Do you want to explain how that looks like in Germany? Because I think it's quite similar. We are having
it's quite similar. I think the protection is better of the employees in that field. But apart from that, it's quite similar. It's a job that is not well paid. It's a job where you have women and migrants. And I mean, during the pandemic, what you've seen all over Europe is that all these jobs, also like care in hospitals, people were clapping, people were paying more attention to these jobs. But in the end, so far, it hasn't turned out anywhere I know of that they would get seriously more money. I mean, seriously better paid. And so it's basically the same as in the US, and you have a lack of employees there. I mean, if you think of it, in Germany, the issue with intensive care for COVID patients was not that we don't have enough beds, but we have more than enough beds, but we don't have people working there. So, I mean, it's incredible because the jobs are so stressful and so badly paid that people don't want to do that there are better options. And it's utterly important work. So, yeah, I completely agree with what you said. We have to reconsider that system.
Yeah, plus what we see now is that poorly managed homes for elderly people are a health hazard for society, basically, because they have COVID infections, and then visitors are getting infected, etc. pp. So there's, from whatever perspective you look at the problem, obviously there is a problem that needs to be addressed. Before we're getting to a close, there's another interesting question. I quite like this audience, which is large, and that's for Christiane now. Large corporations in Germany are now required to meet gender quotas. I think that's for the boards. That's meant here. What is the likelihood political parties will adopt similar policies? I'll start with that one, and then there's an extra question for Julie, and I'll add that. So basically, this person wants to know if political parties in Germany are going to adopt gender quotas, and I believe some of them have already.
Exactly, that's what I wanted to say. Some of them have already, and they have been partially successful with that. An issue that is big in the discussion is always, well, we don't get the women. And there we are back to structural questions. How are the structures? Is this a job that the way it's structured, women actually want to make, that is welcoming for diverse groups, not only women? And it's often not even, but I think that there was an interesting discussion in Europe during COVID. I don't know whether this was reflected in the US as well, but that the countries who had female leaders and also the firms who had female leaders went better through crisis. So we had this with the firms in the financial crisis, we had this now with COVID on a national level. So somehow there is a bit more awareness that diverse leadership, different ways of leadership might be useful. So beyond the quotas, I'm a bit hopeful that there is a bit more awareness now, but the quotas are necessary, of course, to I think, are necessary to get the women there. As long as there are no women, there are also no role models for young women. So you're perpetuating it as a male structure.
Okay, and then the same person has a question for Julie, which is there opportunity for American organizations to adopt similar policies meaning gender quotas?
It's a great question. We haven't done that so far, and I think that there's definitely pushback for that. And I think part of the work is around building power for women in many different spaces, right? So part of it's like right now we have certain places where you have to be to have power and to have influence over resources and over our laws. But, how can we change that center of gravity? How can we make it so that, those centers are the communities, those centers are the families, and that's where the power lies so that we can sort of change things, so it's great to have enough women somewhere, and it's great to have a requirement to have enough women somewhere. But, to that point, like just having enough women isn't enough. You also need to change the way things are done. You need to change, the level of support. You need to change the cultural norms, the level of resources, and who has the power to have additional influence.
Okay, I have one last question for you before Steve tunes back in. Very, very, very briefly, what is the main lesson to be learned from COVID pandemic and its impact on women? Christiane, is there one main lesson that we should learn and a mistake we should not repeat?
One main lesson is difficult, but I think we should reconsider what is important for a society, basically. So it's care is important, education is important, equity is important, and that has not been in the focus, partially also because it wasn't so necessary, because we were just doing well. In many respects in Germany, no, I mean, we had a pretty good situation over quite some time. But I think that is very important to just reconsider our values and what is success and what is important for societal success.
Thank you. Thank you, Julie.
Ditto again. Basically, if we had the care infrastructure, the care systems we needed, if we valued care the way we should, if we had those things in place before COVID, we would be in a different situation. So let's put them in place now so that we never have this experience again.
Thank you very much, both of you. I really did enjoy this discussion. Thanks ACG and Heidelberg Association for letting me moderate. And I will keep following you on Twitter and hope we get this solved and don't see each other next year and debate the same problem again. Steve?
Yeah, let me follow your words of thanks, Birte. This has been an important, fascinating, and really nuanced conversation. Obviously, there's a lot more work to do when it comes to achieving gender equity. But perhaps the silver lining from the pandemic is increased awareness about some of the issues that you've all talked about today. On behalf of both the American Council on Germany and the Heidelberg University Association, I really want to thank you. Thank you, Christiane Schwieren, Thank you, Julie Kashen, for your insights, and Birte Meier, thank you for flawlessly guiding the speakers today through the conversation. And of course, thank you to our viewers for a lot of great questions. This has been really a fantastic discussion. So thank you again for making the time and for joining us today.